This is Dr. Kathryn reporting for Room Now in Chicago, ACR 2018. I just been through the most incredible lecture. It was the Paul Klemperer Memorial Lecture given by Joseph Smolin. And I have to say something about this lecture because it's like basically eating chocolate and sipping on champagne throughout the whole lecture. He very luxuriously leads you through the life of Dr. Paul Klemperer, all the contributions that he has made, and in fact also had given us a little insight into Dr. Klemperer's family. In fact, there was a famous composer that Dr. Klemperer was related to, and also an author. And the author had written this quote, which I'm going to read to you. It says that words can be like tiny doses of arsenic. They are taken unnoticed, appear to have no effect, but after some time, their poisonous influence becomes a reality. And here Dr. Smolin referenced that we have to think about our political climate because our words are toxic. So he then transitioned into rheumatoid arthritis, its history, how people back then, when they diagnosed rheumatoid arthritis, the damage has already been done. The deformities are there, the crippling. And in fact, it took years before people recognized that if we intervened early, then the damage could be halted. He also mentioned how the development of disease activity scores came about, the DAS-28, the CDI, and so on. And what's interesting now, and we've always believed into measuring disease activity so that we can treat to target, but he calls the DAS-28 obsolete. And the reason why he calls it obsolete is because of our newer drugs. The DAS-28 score relies so heavily on acute phase reactants in terms of its calculation. And with our IL-6 inhibitors, it suppresses acute phase reactants, so it can falsely look like the patient is in remission when they're not. So an answer to that, he says, is perhaps using the CDI as a way of measurement, or perhaps even other tools to be considered. And then he also talks about how joint performance and function actually is related to cartilage damage, not to joint damage. There's many reasons why we need to treat to target. One is that it would allow patients a chance for remission if we are to be able to intervene early. Two is it decreases the risk of structural damage. And three is that patients actually would have the greatest benefits in terms of being able to function longer and have better productivity. So all in all, I really think if you have a chance, download Dr. Smolin's lecture for the Paul Klemperer Memorial Lecture off of the ACR Beyond website. This is Kathryn reporting.